Hi. So from what I've been hearing, it seems like the majority of pediatric research in this area is centered around autism. Are there any other pediatric studies going on looking at other conditions, or have there been any noted age effects? Like, is potentially higher success rate at younger ages, or does it tend to be more across the board effective in various conditions?
Think if you just look at any disease, and if somebody's thinking about microbiome role in that, there usually is a hit. Something's going on there, at least potentially. Somebody's interested in that. So is there something unique to pediatrics? Are there other conditions related to autism? For example, we have a trial in Pitt-Hopkins disease. That's a very rare condition. It's a genetic condition associated with severe autism as well. There's only 1,500 patients in the entire United States. The early trials now show with the handful of patients that this is actually surprisingly helpful in that condition. That might be actually a breakthrough therapy to your answer when you're dealing with a real rare disease. You may not have to do as extensive trials to get to the FDA approval, so that could happen. Kids get all the diseases that adults get, maybe in somewhat different form. It is likely, I'm guessing, that when you get to the disease earlier and you change something fundamental about its pathogenesis of how it develops at an earlier stage, there may be actually a better chance of success. But on the other hand, it's a little more difficult to do studies with pediatric patients. There's even more regulatory oversight there.
Yeah, and I was just going to kind of piggyback on that because prior to moving my research into the field of microbiome, I actually worked in pediatrics and I studied the genetics of cancer in children. And I can tell you it is extremely difficult to do pediatric research compared to that on adults. We see the same thing, obviously with pregnant women. There are all these like different kind of populations that get understudied because of the ethics around it, the understanding. So I think some people will shy away from studying pediatric populations because they're more likely to have success with studying adults, at least first. And if you can see safety, especially in adult populations, then people are more likely to move on to studying pediatrics. But I think it's that safety piece that people really get a little concerned about jumping straight into pediatric research.
Wanted to mention, so with peds in mind specifically, developing a formulation that's appropriate for really young children, we recently developed powder formulation. So we separate the microbes, really clean them up such that there is really no residual odor or taste of anything fecal remaining. And then that powder is put into a sachet and you put it in medium like chocolate milk and you just drink it. So young children may have difficulty swallowing capsules and you don't want to instrument them with enemas every day. So we're actually looking forward to moving on with clinical trials in pediatrics with that.